Welcome everybody to Shutting the Revolving Door, our ATI panel on our criminal justice work that we have been doing at CCEH with the many partners that we have today and many of you that are out there. We would like to start with just drawing your attention to our Housing Equals Justice campaign. We are focusing on housing equals justice at this ATI, but also throughout the year. We are hoping that Connecticut will be one of the first state to really have housing equal justice in race equity work, in criminal justice work, and social justice. We're drawing attention to housing as a matter of justice across these spectrums, and are really hoping that today in our presentation on our Department of Correction Reentry Housing Assistance Program that we will help move towards that as well. And then I also want to just draw your attention to, we have a store that is available on our website. As you can see the link on the bottom of your screen there to check it out. It's our Housing Equals Justice store, and we've got some products that are available for you. And then just a special thanks to our sponsors, our presenting sponsors, they're Bank of America and Zillow, and we have much gratitude towards them. They have allowed us to offer this whole conference, this whole week, to all of you that are out there for free. And so it's been enormously helpful. Okay, I'd like to introduce Eleanor Michael, the Assistant Director for the Criminal Justice Policy and Planning Division of the Office of Policy and Management. She's going to be introducing our other presenters as well and talking a little bit about them. But I just want to say a few words about Eleanor and what she brings to the table here. For the past decade, Attorney Michael has served the state in a number of different capacities, including the Undersecretary for Legal Affairs at the Governor, at the Office of Policy and Management, and also as Deputy General Counsel in the Office of Governor Daniel Malloy, where she worked as part of a team to draft, promote, and implement the governor's Second Chance Society initiatives, which she can share with some of her work on that. In those roles, she really helped to promote a more fair and just criminal justice system. She has a BA from American Studies from Wesleyan University and got her law degree from the Connecticut School of Law. Eleanor, welcome, and thank you for joining us.
Thank you so much, Mimi. It's a pleasure to be here today, and thank you to the Coalition to End Homelessness for this important discussion and for all of the important discussions happening this whole week. I also just want to say a quick thank you to all the panelists here today. I know that we work together every day. We were just discussing that some of us are actually seeing each other for first time on video because of the odd pandemic situation we find ourselves in. So it's a pleasure to see you all, and thank you to everybody joining us virtually in cyberspace as well. Just a couple of quick housekeeping notes before we get started. I understand that I'm going to kick off the panel with some introductory remarks, and then we'll turn over the conversation to each of our esteemed panelists, and we will reserve some time for Q&A at the end, as I think Mimi shared. So if you have questions, you can type them in the chat box from what I understand. So I just wanted to talk a little bit today about this project, to give an overview of the project, describe OPM's role in it, and to talk about the goals before I kick it off to the other speakers to talk about more the nuts and bolts of the program and their particular roles in it. So as anybody who has worked in criminal justice knows, and I'm sure anybody who has worked with the homeless system knows as well, and we have seen anecdotally a million times over, there is a revolving door between corrections and homelessness. That was something that we had heard and we had seen firsthand, but we had not particularly studied. And in the Criminal Justice Policy and Planning Division at the Office of Policy and Management, we have a research division that for the first time worked with the Coalition to End Homelessness to match up data sets between the Department of Corrections and HMIS to better understand how those two systems interact, because we know that having a stable home reduces an individual's likelihood to recidivate and also improves their reentry into society. So we really wanted to drill down and get a better understanding of sort of that Venn diagram and where the overlap is and how much overlap there is between those two systems. So in 2019, the Coalition to End Homelessness, in partnership with DOC and the Office of Policy and Management, conducted a data match to understand the intersection. And the data match found, and I think there's a slide on this if you want to pull it up, Amber, that 48% of people who used a homeless shelter in the last 3 years had a DOC record. So almost half. 21% of the people who used a homeless shelter in the last 3 years was released from DOC within the last 3 years. And of those, 66% were homeless prior to DOC. So it's interesting, you know, some of the folks were homeless before entering DOC, some of the folks were homeless after entering DOC, and in some instances, they were both. The intersection of incarceration and homelessness is substantial. 20% of the homeless population and 8% of DOC releases. So again, the pattern of DOC involvement appears to entail multiple repeated short stays. Again, this revolving door that we've been talking about, in and out of both systems. While Connecticut has seen a steady trend of prison population reductions, in fact, we have actually cut our prison population in half since 2008. We're still figuring out how we can continue that trend, and are thinking that perhaps a focus on the homeless subpopulation will help us do that. Connecticut also has an effective homeless response system, which I'm sure Mimi and others will talk about, that involves triage and assessment to provide early intervention and to tailor housing and service assistant to need levels. And so again, that's where we thought there might be some interconnectedness between these two systems. We could take the lessons learned from the homelessness system and the CAN system from the past years and apply them to this DOC population. So just to talk a little bit about OPM's interest in supporting this project, once we realized the sheer magnitude of the overlap between these two systems, we started to think about what we could do with this information and how we could start to slow and or eventually hopefully stop this revolving door. Through our work with the coalition, we learned about the rapid rehousing program and the pilot that CCEH had undertaken with Court Support Services Division of the Judicial Branch. The Coalition to End Homelessness did a tour of this pilot down at Columbus House in New Haven. And we learned more about this program, this pilot program that was launched in 2019 to provide time-limited, service-intensive housing stabilization intervention to assist households experiencing homelessness and those on the verge of homelessness by providing, number one, case management, and number two, temporary financial assistance designed to secure and or maintain permanent stable housing for program participants. So again, understanding how important it is that someone have stable housing before they can have a successful reentry into society. After learning more about that pilot, we started to think about whether or not we could set up a similar project for folks who are going to be reaching end of sentence at the Department of Corrections and would otherwise be entering into homelessness. OPM wanted to provide support for this program, so we looked at our grant funds first, and we found we had a small amount of JAG grant, Justice Assistant Grant dollars from the federal government, about $180,000 that we could use to get this up and running. We thought, well, maybe we can get this program going for a few months and see if we can have some success within the DOC population modeled on the judicial pilot. And then, of course, came the pandemic. And, you know, a lot of times there are silver linings in these moments of great crisis. There are opportunities that come, and the opportunity that came for this project was that we received an influx of federal funding to help prevent the spread of coronavirus. So with those additional grant dollars, we were able to scale up this program and provide a new additional grant to the coalition of 1.8 million to really scale up this program and extend it from a program that we felt would last a few months to a program that will hopefully extend over the course of an entire year. So while this funding is grant funding at this time, it is time limited. We're really excited about this collaboration. We're really excited to see what comes of it, to track outcomes and hopefully garner some lesson learned for going forward. And we're also excited because we're hopeful that even if the funding does dry up, it's created new collaborations and new pathways for individuals and for work between all these different entities that you see represented here today. We've already found a way that DOC can identify individuals earlier who are likely to depart into homelessness. And I think that will fundamentally change the way that the DOC does business going forward and help provide a softer landing for people who are re-entering into society. So when we talk about the overarching goals of this program, there are two. The first one was simply to reduce the flows of people who hit end of sentence and return to the community into a homeless shelter. But then, of course, the coronavirus pandemic amplified the need for us to do this in order to mitigate the spread of COVID-19, both within our correctional systems and within the homeless shelter system. So that's just a basic broad brush overview of the program and how it came to fruition and the goals of the program. And with all that being said, I want to take this opportunity to introduce our esteemed panel of speakers today who will tell you a bit more about the nuts and bolts of the program from where they sit in each of their respective agencies. So first, as you met at the beginning of the panel, we have Dr. Mary Ann or Mimi Haley, who is the Deputy Director of the Coalition to End Homelessness. Mimi will be talking about the program-specific goals, the partner roles generally, program logistics, and preliminary data and outcomes that we're seeing. Next, we have Nicole Thibeault, the Director of Reentry Services at the Connecticut Department of Correction. This Director of Reentry Services, I believe, is a new position that was created under Commissioner Semple a few years back and has really been a wonderful position, and we're so thankful to have Nicole with us here today. She'll be discussing the role that DOC plays within this program and identifying the individuals who would be appropriate and working with the other partners and providers. Next, we have Michael Aiello, who is a program manager for the Court Support Services Division of the Judicial Branch. Mike will be discussing the CSSD role, the resources available through CSSD for the reentry population, and the CSSD Rapid Rehousing Pilot Program that I mentioned at the outset. And last but not least, we have Ron Steed from New London Homeless Hospitality, a Department of Correction Reentry Housing Assistance Program provider. Ron's going to really be providing the on-the-ground perspective from both providers and clients, as well as sharing some of the successes and challenges that we've had with the program so far. So with that, I will turn the microphone over to Mimi to introduce the first speaker. Thank you so much.
Thank you, Eleanor, and thank you everybody for joining us. Amber, if you could advance to the next slide, I'm going to just give some overview of what the program is and some of the logistics of the program, and then we'll get into the presentations of our other speakers here. And then we also want to invite everyone, though, to there is a Q&A thing on the bottom panel of your screen that if you would like to submit questions in there, we'll be fielding questions as we go, and then also hopefully have some time at the end for questions for individual panelists. So thank you. I want to start though before launching into some of the slides to just give some gratitude towards this collaboration that has occurred, which has really been phenomenal. Eleanor mentioned it, but really between DOC, and OPM, you know, were really leaders in kind of paving the way for this, as well as our Department of Housing. I realize we also have probably some people from out of state, so some of our acronyms might not, you know, always come through. So we'll try to make sure that we're using the language behind the acronyms as well, and also the court support services, and Mike Aiello is going to talk about that. But I also just want to say thank you to all the reentry roundtables that are out there, and some of the reentry folks that have been working with us in particularly in New Haven and the greater Hartford area in Bridgeport. We've had some just amazing partnerships with them, and so we're hoping to expand that even more across the state in those partnerships. And also just a special thank you to Yale Transitions Clinic, who's been with us at every step of the way. And then just another note to just of appreciation that is really deeply felt by me, I know, and I think by all the clients that they have helped, is the providers that agreed to do this work in the beginning of a pandemic, that without a lot of funding, if any funding at all. And those providers, I just want to name them because it really has been a tremendous honor to be working with these providers and the case managers that have been doing this work in the middle of the COVID crisis. So Columbus House, Operation Hope, New London Homeless Hospitality, CHR, Bethel and Milford, TVCCA out in our Eastern Can, Supportive Housing Works, New Opportunities, and also United Way, both the 211 United Way folks, but also United Way in Greater New Haven. They really have been a part of this all along and have been part of the program designers in figuring out how to make this all work. So many thanks to them, and also my team here at CCEH, who have been tremendous. So the program goals, you know, as Eleanor mentioned, are really to improve housing outcomes for individuals reentering the community. From the homeless service side, it's really about also, you know, reducing those inflows into shelter and homelessness. We want to make homelessness rare, brief, and non-recurring. And so there's a lot of focus in this program around that rare component, that we are, you know, addressing the inflows into homelessness before somebody becomes homeless, or we are also, if they are living in shelter for a temporary period of time, that we're making that episode as brief as possible. We also want to decrease that overlap that Eleanor mentioned, of course, between homelessness and incarceration, that data project showed, and decrease recidivism. Next slide. The core partnerships we've already talked about, and so we can move on to the next slide. I wanted to talk a little bit about just the program logistics to give you a sense of what the program looks like. At the 60-day mark, approximately, DOC, and Nicole is going to be talking a little bit more about this, are identifying clients that will be discharging that would not have a housing resource at that juncture that they've identified as otherwise being homeless. And between that 60 and 30-day mark of pre-release, DOC and the reentry counselors and discharge planners are working on trying to figure out some solutions in that interim. If at the 30-day mark that individual has not secured any sort of housing to go to, then they would be referred to this program, that if they're end of sentence. And so then DOC and Mike Aiello's team at CSSD will begin working on housing solutions for clients that might be that are on probation, that might be eligible for their transitional housing. If they are unable to find that transitional housing spot for them, or it makes more sense for them to be referred into this program, then they'll be also referred to that regional lead agency of those providers that I talked about. The regional lead agency then begins working with clients at the 30-day pre-release mark if they're not on probation, or if they are in need of housing and we know that the CSSD transitional housing is not going to be available. And then really the lead agencies are working to ensure both that there is temporary placement so that nobody is discharged to homelessness. So in the middle of the pandemic, there has been, you know, hoteling that has been made available through this funding, and but also other temporary solutions. So some people have been able to temporarily stay with a relative. The providers are also working to divert people if possible, and we've had clients that were diverted, for instance, to Chicago, and we've had clients that were able to divert and avoid shelter and having to go into rapid rehousing, going to live with a relative or some other natural support. So it's a combination of both shelter diversion and rapid rehousing. And then if they do end up going into a rapid rehousing segment of the program, then they will be served with case management, and, you know, we'll be bringing all that we have within sort of the rapid rehousing structure to help those clients get back on their feet and stabilize and be able to then be independent. So we track the referrals and the progress. We facilitate those connections with the community, with the whole team here, and really work to help administer the flex funding across the state with the help of the regional lead agencies. This is just an example of some of the uses of the flex funds. The majority of funds are used for security deposits and rental assistance. We do have some motel and hotel expenses in certain regions that have not had temporary shelter available, but it can also be used for rental applications, transportation expenses, and as if you're from the homeless service side and you are familiar with our shelter diversion efforts, we want people to get creative about how we are helping people so that we're providing enough funds so somebody can become permanently housed, but not you know, create a long-term subsidy if it's not needed. So this is just the breakdown of the regions, our CAN regions, coordinated access regions, and how the discharges have happened. As you can see, Greater Hartford is the one that has the most releases to that community. Greater New Haven and Fairfield County are approximately the same. At 18%, our Eastern CAN, our eastern side of the state, has about 11% of the releases, and then Central at 7%, Northwest, which is the Waterbury Litchfield area, at 9%, and then a smaller percentage for our Meriden, Middlesex, Wallingford at 4%. Thanks. This we thought was very significant too, is that there is the clients that already had an HMIS ID, and about half of the clients had a previous episode of homelessness and were in our homeless management information system already. So actually 57% prior to you know, release. So it's a significant percentage are already in our system. Already on our by name list, we had 19% that were already on our by name list, which is the list that we have for people that are waiting for a housing resource. So this is a direct, you know, assistance that can go towards helping those individuals that would probably be having another type of resource directed to them. The age distribution, we wanted to do a breakdown of that. In particular, that 60% of the releases are 35 to 54, but we also had a significant number that are over the age of 55, and that just points to some of our aging population in homelessness services in general, but certainly for this population as well, and some of maybe the increased medical needs that are there for them. Number of episodes of homelessness, and I am, yes, so can't see the bottom of this slide, but so the number of episodes of homelessness, I don't know if everybody, if they can see the bottom and the breakdown. So the 11% had no episodes of homelessness. I don't know if Amber, you can move up the slide so we can see the bottom of it. But 22% had more than 3 episodes of homelessness, which is a very significant percentage, and 45% had at least 1 episode of homelessness. Okay. The breakdown of the solutions, I had mentioned rapid rehousing. So this is this initial cohort of our outcomes, the preliminary outcomes were about 46%. Received rapid rehousing, 37% were able to be served by CSSD, about 4% self-resolve, another 9% were served by some sort of DMIS program or recovery or mental health, and then about 4% just declined services. So it's a work in progress. We're learning every single day. There's something new and we are revising as we go. But some of the early, I think, wins so far have been that we've been able to establish providers in every CAN region. We've created a system for having those problem-solving housing conversations 30 days prior to release, which in most of the regions it was at 48, which made it very difficult, I think, on both the DOC side for our providers, but also for the clients to be able to have good housing outcomes, to begin that planning process earlier. We created collaborations that I've already talked about, developed a new system of referrals that goes directly from DOC to our providers in the regions. We've received approximately, it varies in terms of the number of referrals, but in this slide, it's 61 referrals in 45 days. And we've improved the discharge planning process, I think. And we've conducted a lot of trainings and meetings and done a lot in terms of just assistance in helping clients and providers and our different segments to understand each other, which has been, I think, very, very helpful. We've also put this program into HMIS, so we'll be able to get even more data as we go along. And now I would like to introduce Nicole Thibeault. Nicole began her career at DOC in 2005. She is the Director of Reentry Services with the Department of Correction. She started as a correctional counselor at the Bridgeport Correctional Center and spent several years at the Community Services Division and was promoted to the counselor supervisor there, overseeing the central intake unit. She also served as a deputy warden of programs and treatment at the Osborne Correctional Institution, and now she oversees the reentry unit, which I'll let her share what she does. Nicole, welcome and thank you.
Thank you, Mimi. Thank you, everyone. Good afternoon. I oversee the Reentry Services Unit for the Department of Corrections, and I am fairly new to this role. I stepped into this role in July when this program was already up and running, but luckily I had stepped in at the right time where the additional funding was received and I was able to be part of the planning to move forward on this project, which was really exciting to work closely with the panel members today. The Reentry Services Unit within Department of Corrections, what we oversee the main areas of reentry for the offender population, to include housing needs, but also we oversee identification, procurement, family reunification, higher education, employment, voting, and as I said, housing specific to this project. We have a reentry counselor that is assigned to each correctional facility, either full-time or part-time, and they are the staff members that are involved in the housing referral process for that facility. When we do start discharge planning for an offender, it's usually within 30 days to their discharge, and these offenders that I'm mentioning are those who are fully discharging from the Department of Corrections without any form of early release or community supervision. And these are offenders that are identifying as homeless at the time of discharge planning. We are working on increasing from 30 days to 60 days to be able to have more time to do discharge planning for this population and try to secure housing resources further out. This is, again, the population that is not afforded any type of early release community supervision, and the population that is afforded community supervision or early release are usually, if they are homeless, we usually afford them a period of time of transition in a halfway house prior to them discharging from the department. When we identify someone who is homeless, we immediately submit a referral through the rapid rehousing program to the region that the offender is choosing to return to. And as we've mentioned several times throughout this presentation, it is quite a collaboration. Since March, when this program got up and running, we have submitted approximately 182 referrals for homelessness for our population. 47% of those 182 referrals are those who have probation to follow their incarceration. So the collaboration with CSSD and Mike Aiello's shop has been great. We've been able to work very closely with them in that to try to assist with securing housing for clients who will be on probation supervision after their incarceration. Out of the 182 referrals as well, approximately 93% of them have been male with 7% female since March. We are currently averaging approximately 23 referrals per month for discharging homeless offenders. And we had a spike in April when we were really at the height of COVID. When we started looking at when we went through COVID, we found a couple silver linings going through the pandemic of things that we really want to focus on moving forward. One of those being our pretrial population. So typically when we are talking about reentry and getting offenders ready to discharge, it's usually those that are sentenced and finishing up their sentence. However, we did really identify that the pretrial population, there are a lot of homeless offenders within that population as well. So moving forward, as we continue to learn and grow with this program, we will be looking to engage the pretrial population as well to ensure that we are assisting them with their housing needs if they are discharged from the department without even getting sentenced. So that is something we are looking for moving forward. In addition to housing, when we are assisting an offender with reentry, we also have staff who assist them with obtaining their medical insurance and any type of other social services that they need. So the reentry counselors that work within the facilities, they work closely with the discharge planners that are assigned to those facilities for those offenders who have mental health needs, making sure that we are lining up treatment for them in the community to ensure that we have that continuity of care there.
Thank you. Thank you, Nicole. I just have to say that Nicole and her team are so great to work with. We are in constant communication throughout the day, as well as like the scores of people that have been involved. And so it's really been wonderful working with you. And Mike Aiello is up next, and I'd like to introduce Mike, who I've known for years now. I think I can say that. We've been working, I co-chaired a criminal justice task force that Mike was a great participant in, and we have gone back and forth on a number of issues over the years, and it has really been a true pleasure working with Mike. And in this program, I think we're both so excited to see some results from some of our work, I think, over the years. Mike has 23 years of service with the branch in CSSD and has worked in all different capacities in program compliance, adult and juvenile residential services. He worked in the DNA program, the jail re-interview program, electronic monitoring, community-based sex offender treatment, and toxicology. He also worked for 7 years in a community nonprofit in New Haven. I love doing this because I get to learn like what your backgrounds are too, which I didn't know before. He worked in transitional housing program there. He got his undergraduate degree from Fairfield U and an MPA from University of New Haven. And welcome, Michael.
Well, thank you. That about covers everything there is to know about me. So, yeah, I just want to run through. We do a lot of collaborating. We collaborate with DOC very closely. We collaborate with the Department of Mental Health and Addiction Service and a lot of other state agencies. We work with OPM, but we also work very closely with our community partners. Not only the agencies we contract with, but with also CCH, the Partnership for Strong Communities, and another number of other community providers. What we do in CSSD in the branch, we oversee adult probation, the bail commission, juvenile probation and juvenile detention, family services, but we also have a large contracted network of outpatient community providers, and they include adult behavioral health services like mental health and substance abuse evaluation, mental health and substance use treatment, intensive outpatient treatment, anger management. We run a number of day programs where we do criminal justice programming. We engage clients with their criminogenic needs, try and change their behaviors and how they think. We do a large number of juvenile programs along the same lines. But one of the things we also do is residential services. As you can see from the slide we have 167 drug treatment beds that we collaborate with the Department of Mental Health and Addiction Services on. We have a large MOA with them, memorandum of agreement, where we give them the dollars and we basically buy the beds through them. We do a lot of contracting directly, but as you can find out, in order to save and make efficiencies, it didn't make a lot of sense for the branch to continue contracting for something that already existed within another state agency. So that collaboration has been fantastic. We work mutually with DEMIS to help providers increase programming, increase census. As you can see, we give them $5 million. All the programs are licensed through the Department of Public Health. There's various lengths of stay that we contract for. They usually get about 20 hours of drug treatment every week. During the calendar year of 19, we made 2,445 referrals, and they admitted 916 clients. Those clients, those referrals are either probation or pretrial, like Nicole had mentioned earlier. We service both probation, so sentenced clients who either get sentenced directly to probation. Some come out of the Department of Correction with supervision, with probation supervision, but there's a number of pretrial clients that we help try and divert so that they're not sitting in the Department of Correction waiting while their case is pending. One of the great things about the collaboration, which started years ago with Tom Kirk, when I was very new to the branch, he was a commissioner of the Department of Mental Health and Addiction Services. They gave us access to beds at Connecticut Valley Hospital at no cost. They were having trouble utilization-wise, and if you can imagine in criminal justice, there's no shortage of clients. So we actually, in calendar year 19, we referred 765 clients to Connecticut Valley Hospital, and they admitted 380. And when you do the math, figure out what it costs for a drug treatment bed, that saved the branch almost over $1 million. That's just a huge amount of savings for us that allows us to do other programming for our clients. We also have a transitional housing network. And I often say this, they see transitional housing, and it's a little different in our world than it is in the housing world. It is basically supervised, staff secured housing with some case management, but they don't provide a lot of services there. The services are gotten in the community. So it's a little less expensive, but it does provide that 24/7 supervision that some of our clients require. We have 148 beds, men and women. It's 30 to 90 days. Some clients are there as short as 2 weeks. Others could be there longer. We use it sometimes if someone's waiting to go to a drug treatment program and the bed's not available. Sometimes we use it when someone's coming out of DOC and homeless. A lot of the collaboration that we do with DOC and Nicole and her folks, when someone's coming out to probation and we know they're homeless and they don't fit anywhere, we'll sometimes try and make a referral to transitional housing to see if we can buy them some time before another housing option is made available. During the calendar year of 19, There were 1,849 referrals, and they admitted 946 clients. Amber, if you can go to the next slide. We also have the Sierra Center, which we do in collaboration with DEMIS. That's a program that takes clients with mental health issues. They get a lot of their services in the community through the LMHA, through our other contracted providers. We have other contracted services that they also access. But we have 14 of the beds, and DEMIS has 9 of the beds. That actually adds up to 23. So that's something I can always change in the PowerPoint going forward. But again, we made 162 referrals, and they admitted 40 clients last calendar year. We also have reach beds, which we do in collaboration with the Department of Correction as well. They have the contract for those services. And again, rather than us recreating the wheel, through our MOA, we give them money, and they provide us the service. We have 16 reach beds. The average length of stay is 3 to 6 months. That's another way to give people who are in the community on probation a safe, stable place to live, so our probation staff can provide the case management, provide the supervision, and also the services for clients. So we had 45 referrals there last year, and the 40 clients were admitted. The January Center, a lot of people, this is where there's a lot of pushback. It's a sex offender program, a residential sex offender program, one of the few in the country like it. 12 of the clients are judicial probation clients, 12 are from the Department of Correction. Again, it's a collaboration we do with DOC. We had 40 referrals there, and they had 32 admissions last year. One of the key things I want to talk about, those are some of the things we had that were existing. And we work very closely with our partners to try and make sure that we utilize those appropriately, get the right clients in, and that we're helping divert people not only from DOC, but when they leave DOC from going back. Along the lines Mimi talked about earlier, we have been working together for years. Us, other state agencies, the Veteran Affairs, Department of Housing. We've been on a lot of committees together, and we've tried to find ways to collaborate. You know, the hard part is the funding. You know, we can always figure out ways to provide housing services for people, but it's always hard getting the funding. Our dollars are all set for different populations. You know, we're trying to reduce criminogenic needs, recidivism. DEMIS is trying to reduce drug addiction. And the housing folks are trying to reduce housing. So how do we pull it all together? You know, I was able to scrape up a few dollars, not a lot of money, $30,000. And I mentioned to Steve Dillella from the Department of Housing, we talked about this with CCH and the partnership, and we're just like, it's all I have. I don't know how many people we can house with that. But they looked and said, hey, you're making an effort. Don't worry about the housing. If you can help fund the position at the community provider, we'll come up with some housing dollars. They came up with $150,000. We worked with one of their existing providers, the Columbus House in New Haven, and we were able to establish a program where we would identify clients, probation clients in New Haven that were either homeless or unstably housed, and we would refer them through our adult probation office to Columbus House to try and find some permanent housing solution. So the clients could be at the shelter, they could be at our transitional housing program. Some are under a tent. So we referred 38 clients. A number of them refused. They initially got in and then said they didn't want to participate. But so far, since the first referral was made in September of 2019, we've been able to house 21 clients. 15 have discharged and completed and are on their own. 14 of those 15 are still housed and paying for the rental on their own. There are 6 still currently in the program. So they pay a portion of the rent starting from zero, a portion of their income starting from zero, then it gradually increases. And by the 3rd month, they should be paying 60% of their income toward the rent. They don't pay the rent, they pay a portion of their income. And eventually the goal is to get them to pay the entire rent themselves as they move through the program. So that has been a phenomenal success. And we talk about how you measure success, and people are always like, what are the numbers? A reporter, well, just recently, a reporter has been interested in the program. We're discussing what is, true success. And just the change you make in someone's life, to me, is enormous. And I think that's a success. But what we talked about, who is housed and what's the retention rate? Columbus House reaches out to them, I believe, every 30 days. So we're going to be watching what is the retention of those 21 people that have gotten housed over time. How long do they stay housed? And then over years in the branch, in CSSD especially, we look at recidivism. So then we'll look over a year or 2 years, what are their recidivism rates? What's their rearrest rate? To see if there's a difference between those clients and our general population. So that's an important new step for us. It's in its infancy. It's a year old, and half the year was COVID. So I don't even know if that's you know, a real good measure yet, but I'm hoping we can get additional funding to expand that. We're talking with CCEH and Mimi. We've been meeting regularly to try and find ways to increase funding to expand this program. We've talked to Nicole and Mimi about possibly expanding it to pretrial clients. You know, that's a huge population for us. And then how do we best access that? The last thing I want to talk about is a way for us to get real data. A lot of times we do a lot of things that are anecdotal. We know criminal justice clients have housing issues. There's pushback for sex offenders in the community. So one of the things we worked really closely with the partnership with CCEH and the other people around the table, all of the state partners, was a housing survey so we can identify, at least in the probation or in CSSD, what is the true nature of the homeless problem. So we worked collaboratively with everyone to come up with 6 survey questions. And we're asking them in every discipline. We're working them in. Right now, we ask these 6 questions in adult probation, juvenile probation, detention, and we just went live in bail, I believe it was September. We're hoping to have it in family and probably maybe in our June release or maybe our March release. But we're working toward that. It's not easy just to add things to all your systems, but we added these questions. We have some preliminary data, and basically the goal is to identify housing, homelessness and housing instability in real time in the adult probation system, in our bail system, in our juvenile probation system, as opposed to relying on a lot of anecdotal data or data match, which give you stagnant data. It's data, granted, and it helps, but we want to real time know when someone comes to probation who's homeless and when they discharge, are they still homeless or was there a change in that housing system? So we just started that this year. We're going to continue working on that, refining it, coming up with data. I shared some preliminary data. It's very small because, again, you know, you're asking these data questions when you're meeting with your probationers. And during the pandemic, we have not been meeting a lot with probationers. It's been telephone contact. But now that we got it in the system, we're going to be going back retroactively and looking at all of our clients, asking all existing clients these 6 survey questions, and then doing it for our pretrial clients. And not only are we hoping that it gives us the data that we want, but also drive some action for our staff person to call 211, to engage them in some type of housing service, to make a referral. Or if they're a pretrial client and they're going to court and they identify as homeless, to maybe suggest to the court a transitional housing referral if they're willing. So those are the things we're working on. Again, I can't thank the people on this panel enough for their collaboration. They're working with the branch, but our providers too, because I think Mimi, Nicole, Eleanor, everyone has said it. No matter what we did, no matter what we think of, without our providers who meet with these clients every single day and work with them through their housing, through emergencies, through mental health crisis, nothing we do matters. So I want to thank you, and hopefully this continues.
Thank you so much, Michael. That was great. I want to turn to, and Mike, you have, I think, a question for you in the chat box that you might want to, that's directed specifically at you. So if you want to check that out and just remind people that you can ask questions through, not the chat box, the Q&A box. Ron,
I'll do my best.
Okay. I'd like to introduce Ron Steed. He's a deputy director at the New London Homeless Hospitality Center, where he manages the shelter supportive housing programs. He also worked for 26 years in the Navy's submarine force, which I did not know about you, Ron, and was also served on the board of directors and as the chair at New London Hospitality as well. He graduated from the Citadel and holds a master's degree in engineering management from Old Dominion. He also serves as an Episcopal deacon at the St. James and Preston and Grace Church in Nantucket. And I welcome you, Ron. Ron is one of our providers that we have talked about, who works with the team in New London to serve the clients, and has had some tremendous success in your region with this program. So thank you for all of your work, Ron, and please, if you can share with us some of the key things that you have done, that would be wonderful.
Hi, everyone. You know, it turns out that homelessness is remarkably like submarining with a lot less radiation. So, you know, I really enjoy it. Here in the Eastern Can, our partners at TVCCA handle participants in this program who are going to the north end of the state. And then we handle folks who are in the south, mostly in Norwich and New London. I think it's no surprise, of course, that the key to this program has been relationships. This is one of 4 rapid rehousing programs we have here at HHC, and they all exist on a continuum, from some which are very case management intensive and others which are not so much. This one falls in the middle, and one of the things I really appreciate about this program is its flexibility. You know, we have always talked in our shelter about the challenge of DOC people who would get released from DOC and come into shelter. And this program has really answered a major concern that we have. Again, COVID has helped to really create this opportunity and help us to think a bit out of the box as we work with these folks. So we really appreciate getting up to a month's heads up or referral on these participants. When the referral comes, it tells us everything we need to know about who the person's counselor is, where they're incarcerated, how do we get in touch with them, and so on. Our case manager, David Horst, has just done a phenomenal job of getting in touch with those counselors and the participants and forming those early relationships. Those relationships have really allowed us to tailor these programs to the person's need, and almost none of them look alike. Sometimes they look more like a diversion situation, and other times they look more like rapid rehousing. So David has gotten very, very good at asking really insightful questions like, what are your links here to the region? Are there family or friends you could stay with? Have you worked here before? What kind of work did you do? Where would you like to live? We really, as a result of that, and thankfully for the COVID situation, I would say fewer than 1/3 of the folks that we've had in this program have even entered into the shelter, which is great. That has helped you know, keep that congregate setting a bit under more control in COVID, and helped people, you know, leave prison and go right into housing in one form or another. As soon as a person steps out of the car in our parking lot, we give them a phone. Our practice has been to take them direct to a hotel because they're coming out of a congregate setting. We want to, if they have contracted COVID, allow us to be able to test for that and determine plus or minus. I'll tell you, we've had no participant who's had COVID so far. I don't know what the record is across the state, but ours has been pretty good. Lots of folks, which has been a surprise to us, have specifically asked not to go into shelter. Ours, of course, like I think all of them in the state, is a low barrier shelter. So there are folks at the shelter who are deeply invested in substance use and so on. And many of the participants in this program have said, I specifically don't want to go into shelter because I don't want to be around people who are actively using substances. That was what got me into DOC in the first place, and I don't want to go back to that route. So in that case, David has worked very closely with our diversion coordinator, and in many, many cases, they've gone straight from DOC into a sober house. We have lots of relationships with several of them here in Southeast Connecticut, and that's worked like a charm. In some cases, you know, typically we think in a sober house that is probably going to be housing that'll last about 6 months. In some cases, we have not had to worry about permanent housing after that. They've been able to work with the sober house to find that. In other cases, we know that at the end of that 6 months, we're going to have to help them find a permanent place, and are happy to do that. The 6 months of waiting while they're in that space has been really good. We also have here at HHC a very active housing department. We have 3 people that's all they do is work with landlords throughout the Eastern Can. And so we've been able to leverage them quite a bit to find apartments. I'll tell you, we have not been unsuccessful at housing anybody who wanted to find an apartment. Some landlords are worried about people who come out of DOC, whether that's good or bad. Others, much less so. We've always found a way, if an apartment was in the future, to find a way to do it. A little bit more about diversion. We have in several cases been able to apply classic diversion tactics. We had a fellow who in that early phone call told us that he had a trucker's job up in Chicago and he had some stuff in storage in Norwich, and could we get him from one place to the other? Absolutely we could. So we rented him a U-Haul van, gave him some money for food and gas, and off he went. And we just heard from him recently, and he is fully employed and doing great. So that was a very successful diversion. Other cases, we've had family members who've been willing to take a participant for a couple of months. We can give them some funding to help defray those costs, and that has worked out really well too. Nicole, could you give me the next slide, please? So lots of options. Flexibility is really the key to this. As I said, our diversion coordinator has lots of resources at her disposal, and so David and her have worked very, very closely. In some cases, we've had folks who've had some pretty significant medical challenges. We do have an in-house respite center here at the shelter, which we can take advantage of, and Community Health Services runs a clinic here within our shelter space, and having those medical people available have been very helpful in those situations. Also do a lot of coordination with probation officers. They also, of course, are interested in housing, and that's been a big help too. One area where I'd say we could probably do a little better is with the Reentry Collaborative and Reentry Councils. We have made connections with them, but I characterize those connections as kind of thin right now. I do think that making those firmer connections would be very helpful. I mean, we have had some participants who have not lived in community in over 20 years, and I could see those councils especially being very helpful. So we're hoping to deepen those relationships a little bit. One other thing I do want to say is about those early phone calls with participants. One of our practices is that as part of the phone call, we'll do a 211 intake right there with the participant and their counselor while we're on the phone. And that has saved us a great deal of challenges. It is difficult for counselors to arrange a phone conference with us, so we try to get everything done in just one iteration if that's possible, and we've had a lot of success with that. I'm happy to answer any questions if you have any. If you'll just put them in the chat, I'll do them, and I think that's all I have to report. Thanks so much.
Thank you so much, Ron. Yes, we've been answering questions as they've come up in the chat box, but I just wanted to thank all of our panelists, because we are at time and we won't be able to answer any questions live, except I do want to draw attention to one of the first questions that came out in terms of race equity and the intentionality of this program around also paying attention to our race equity work. And certainly we're trying to integrate race equity awareness in everything that we do, and that this program, because of the disproportionality of really, ethnicity and race, I would say, in the homeless inflows. A lot of connection can be made with the criminal justice system and the homelessness and that data that we talked about. We do have some slides that we can share and talk about the race equity component within this, but this is one of the ways in which that I think that we can reduce that inequity in the inflows, which is has the greatest disproportionality is that in that rare component of people inflowing into homeless services. And it is deeply interconnected with the disproportionality of incarceration as well. So this is a huge part of why we're doing what we're doing as well. And just want to thank you for that question, and thank everybody for joining us today. We do have a webpage on this program that you can go and see, and just, many thanks. You can see on the screen here too that we have a lot of things that had happened today. We have another panel that's coming up for the Mayor's Homelessness Prevention Task Force, people with disabilities at 3 o'clock, and an ice cream social with our Be Homeful, our very young Be Homeful ambassadors. I hope you'll join us for all of those as well. Thank you, Eleanor, Ron, Nicole, Mike, and Amber. Thank you.